Hello and welcome to Lesson 3. This module, like Modules 1 and 2, is intended for people who provide direct support to individuals with IDD or family members of people with disabilities. This third module focuses on who's more vulnerable to illness and why they may have more severe symptoms than other people. I'm Amy Jerum. I'm the pediatric specialist at the Golisano-Institute for Developmental Disability Nursing at St. John Fisher College. Our objectives for this talk are to identify chronic diseases that predispose residents of group homes and other congregate care settings to poor outcomes when they have an illness, like a cold, a virus, or the flu, or even COVID-19. The second is to identify other related risk factors that predispose people to poor outcomes when they are sick. And lastly, we plan to identify lifestyle risk factors that predispose people to poor outcomes when they have a community-acquired illness. Let's first think about what you might see if a resident does become ill with a contagious illness like a cold or the flu or COVID. You'll notice a change. They will appear sick, and their symptoms may include some or all of the following: a sore throat, diarrhea or stomach cramps, decreased appetite. They may have chills, muscle aches and pains. And with COVID-19 in particular, people have reported a loss of taste and or smell. You don't see this so much with other types of infectious illnesses like a cold or the flu, but do be aware of this symptom when we're talking about COVID. Based on available information to date, some people are at a higher risk for more severe illness symptoms from COVID-19 and other infectious illnesses. Often, people with intellectual and or developmental disabilities will fall into these vulnerable groups, as the disability often predisposes them to chronic conditions. These vulnerable groups include the very young or people over age 65, people who live in congregate care facilities like a group home or a nursing home or other long-term care facility, people with other healthcare issues such as being immunocompromised or having comorbid conditions or chronic conditions. And marginalized populations are also more at risk. And this includes people with intellectual or developmental disabilities, people of color, the impoverished, the less educated. Let's do a deeper dive into some of these conditions so that we can understand how this happens. Many conditions cause someone to be immunocompromised. This means that they have a decreased ability to fight infection. And some of these conditions that cause this are things like having a cancer treatment that weakens the immune system, or smoking. Particularly people who have smoked for a long time have decreased lung function. Bone marrow or other organ transplants. People take medications that specifically suppress the immune system. Some people have immune deficiencies. There's certain genetic deficiencies in which people are born with a condition that weakens their immune system. Other times it could be because they have a different type of an illness that's causing them to be immune deficient, like poorly controlled HIV or AIDS, or prolonged use of steroids or other immune weakening medications. Let's look next at chronic disease. Chronic diseases or conditions are defined broadly by the CDC as conditions that last a year or more and require ongoing medical attention. They may limit the activities of daily living as well, or both of these things. Chronic diseases such as heart disease, cancer, kidney or liver disease, COPD, and diabetes are among the leading cause of death and disability in the United States. Keep in mind, residents with intellectual and or developmental disabilities often have some of these chronic diseases. Their disability and sometimes certain types of medication may put them at an increased risk of having a chronic condition. Let's go back to our case study. Jenny has a day off from work. While she's home, she gets a call from her boss who gives her an update on the resident, Amy. It turns out that Amy was admitted to the local hospital. She's in the ICU and she has tested positive for COVID-19. Jenny's upset and she's scared for Amy too. She considers the time she spent caring for Amy and wonders if she may have contracted COVID-19. During Jenny's time at home, she's spending some family time with her husband, her 2 daughters, and her mother, who lives with them. Her daughters are Angie and Shannon. Angie's 5, Shannon's 8. Shannon has asthma, and she takes albuterol as a rescue inhaler whenever she needs it. Jenny's husband, John, has type 2 diabetes, and he is obese. Jenny's been working on trying to get him to eat a little healthier, but he has a stressful job and tends to grab takeout on his lunch breaks. Now that he's working from home, Jenny has been able to cook for him and make more healthy meals, and she's hoping it'll help with his diabetes and help him get back on track with his nutrition. Jenny's mother, Maria, who lives with them, is 74 years old. She has quit smoking, but she did smoke for a long time and has chronic obstructive pulmonary disease, COPD. Jenny knows that because she has to go out of the house to go to work in a group home environment, she's at an increased risk of being exposed to COVID and other infectious illnesses like common colds and the flu. She also knows that there are people in her family that are in increased risk of having bad health outcomes if they contract one of these illnesses. Let's consider Jenny's family and see if they're at an increased risk for poor health outcomes if they get sick with something like the flu or COVID. If they're at an increased risk, just take a minute and think about what conditions put them at an increased risk. You'll recall from the case study that Angie, who is the 5-year-old, does not have any chronic conditions or anything that puts her at risk. She is young, but she's 5. She's not an infant. She'd be able to handle an illness pretty well. Shannon is also young, but she has asthma. Jenny's husband has type 2 diabetes, and he's overweight. And remember that Jenny's mother, while it's fantastic that she quit smoking, she does have a history of smoking. She's a bit older, and she has COPD. Thinking this through with Jenny in mind, she knows that because of their increased health risks, it's especially important that she be careful to protect herself while she's at work at the group home, to make sure she's wearing her PPE, her personal protective equipment, and following all of the recommended guidelines by the company that she works for and the CDC. She also wants to consider the residents who live in the group home. Many of them have chronic health conditions that put them at increased risk for poor health outcomes. Living in a group home setting with several people living together makes it really hard to socially distance from each other. Jenny thinks that many of the residents in the home don't really like being moved away from one another, especially after Amy got sick. Some of the residents got comfortable with hugs that Jenny gives them, and this comfort to the residents who live in the home, and it's hard when they don't have that, and she has to practice physically distancing herself from them. She knows that the residents won't always understand why and may feel upset and hurt by this. Jenny also knows that the residents' mental and emotional health will be important to keep an eye on during this stressful time. So talking face-to-face with friends and loved ones using Skype or FaceTime could be a great way to help them feel connected. Jenny might arrange for friends or loved ones to drop off books or movies or newspapers or other things that are meaningful to the residents. You can use practical ways to relax by taking deep breaths, stretching, meditating, praying, or engaging in activities that are distracting and that you enjoy. The residents can do these things with you, and it's good to model these types of behaviors for them. Talk about your experience and feelings. Talking things out can really help us process the things that we're feeling and thinking. And maintaining a sense of hope and positive thinking. You could even consider keeping a journal where you write things down that you're grateful for. So as Jenny thinks about these suggestions, she thought of a few things that could be incorporated into the home that she works. 3 things she identified right away that could be incorporated into the residential setting were finding time each day for face-to-face time with each of the residents' families, helping them connect however is appropriate. It may be by Skype or FaceTime. It may be, sending a video or an audio message to one another, but just really figuring out how to make time for that. Another idea was having a group meditation time that's done at a distance, helping residents practice deep breathing and just really staying calm. And then lastly, she thought journaling would be good. And then she could teach the residents how to do this, and they could think about positive things each day and write about them. We're going to move on to Module 4, which considers some of the unique things that we think about for DSP workers or family members of people with disability.